అడెనోమయోసిస్కు ప్రభావవంతమైన చికిత్స దక్షిణ భారతదేశంలో మొదటిసారిగా ప్రవేశపెట్టబడింది. ఋతుక్రమం ఉన్న మహిళల్లో 60% మందికి వైద్య సహాయం అవసరం ఉంటుంది. అడెనోమయోసిస్ ఉన్న రోగులు గర్భస్రావం అయ్యే ప్రమాదం ఎక్కువగా ఉంటుంది. అడెనోమయోసిస్ భారీ రక్తస్రావం, విపరీతమైన నొప్పి గల ఋతుక్రమం మరియు బాధాకరమైన సంభోగానికి కారణమవుతుంది. దక్షిణ భారతదేశంలో మొదటిసారిగా అడెనోమయోసిస్ ఉన్న వాళ్లలో గర్భాశయాన్ని సంరక్షించే సురక్షితమైన వైద్య విధానాన్ని నాన్ ఇన్వేసివ్ ట్రీట్మెంట్ను హైదరాబాద్కు చెందిన డాక్టర్ విమీ బింద్రా పరిచయం చేశారు. డాక్టర్ విమీ బింద్రా సంతానోత్పత్తిని మెరుగుపరిచే సర్జరీ స్పెషలిస్టు, ఎండోమెట్రియోసిస్ ఎక్సిషన్ సర్జరీ స్పెషలిస్టు, గైనకాలజిస్టు, లాప్రోస్కోపిక్ మరియు రోబోటిక్ సర్జన్. ప్రతి నెల ఋతుక్రమ సమయంలో మహిళలు ఎదుర్కొంటున్న సమస్యలు, పరిష్కారాలను డాక్టర్ విమీ బింద్రాతో మా ప్రతినిధి సత్యపాముల స్పెషల్ ఇంటర్వ్యూ.
గుడ్ ఈవినింగ్ ఎవ్రీవన్, అందరికీ నమస్కారం అండి. ఈరోజు మనం డాక్టర్ విమీ బింద్రా అని ఎండోమెట్రియోసిస్ స్పేస్లో వన్ ఆఫ్ ద వెరీ రెనోడ్ డాక్టర్ ఇన్ ఇండియా. ఓన్లీ ఇద్దరే ఉన్నారు ఈ స్పేస్లో, మనకి సౌత్ ఇండియాలో ఈవిడ ఒక్కరే ఉన్నారు. అండ్ అలాగే ఈవిడ ఎండోమెట్రియోసిస్ మీద చాలా పుస్తకాలు కూడా రాశారు. ఈ మధ్యనే ఎండోమెట్రియోసిస్ ఫౌండేషన్ కూడా స్థాపించారు, దాని గురించి చాలా కృషి చేస్తున్నారు. అసలు ఎండోమెట్రియోసిస్ అంటే ఏంటి, దాని ప్రాముఖ్యత, దాని ఛాలెంజెస్ ఏంటి ఆవిడ అడిగి తెలుసుకున్నాం. గుడ్ ఆఫ్టర్నూన్ డాక్టర్.
Good afternoon.
Pleasure to have you on this channel. So a lot of things, the first question is, there have been a lot of talk on endometriosis recently, globally actually, and in India people have been talking about this. So what exactly should we need to worry, because if you look at the number, more than 250 million are affected by endometriosis globally, and close to 40 to 50 million in India have been affected. So what exactly is this phenomenon, and should we actually worry on this?
Thank you so much, Mr. Satya. First of all, thank you so much for doing this session, because endometriosis is a very common problem. It affects 1 in 10 women. It is as common as diabetes, but most of the people have not heard about it. As you said, more than 200 million women are suffering globally, and in India also millions of women are suffering without knowing that they have endometriosis. Now, this is a common myth in the society that painful periods are normal. Now, pain during periods is not normal if you cannot do your routine work, or you have to miss your school or miss your work, or you cannot get up from the bed. So if you have this kind of pain, the most common disease which causes this is endometriosis. So it affects 1 in 10 women, and it's very common. 50 to 60% of women it causes infertility. 40 to 50% of the women have debilitating pain, and their pain is so severe that they cannot do their routine work also. So that is the reason this should be discussed, and more awareness is needed so that people know about it. Endometriosis is a very common disease which is often diagnosed very late, and because of lack of awareness, because people have not heard about it, and over the generations they are told from mothers, grandmothers that pain during period is normal, and they are also told that you get married, have children, it will be fine. So this myth has to be eradicated from the society, because we have seen patients suffering for years together without any pain relief. So there are many medical treatments available for endometriosis, but usually they do not work. So there is surgery called as excision surgery, which should be offered to patients by the experts. It should be done by experts, not by general gynecologists.
That's phenomenal. So how you like to bring awareness so that people talk openly? Because why I'm asking?
This is a very, very important question, because not talking about periods is very common. And in India, as you said, it is a very, very like taboo topic where they don't want to discuss about it. Now things have improved to some extent, but when, like even in our childhood, there were certain advertisements on the TV. They used to change the channels, and I think all of you must have faced this. So this is a physiological phenomena which a woman goes through every month, and until unless we discuss about it, we talk about it, it is very difficult to overcome those taboos or myths. Now, to help that or create awareness, we have established a foundation, Endometriosis Foundation of India, through which we are trying to reach many people and other organizations who can help us overcome these myths and create some awareness. Not talking about periods at work or in family is a problem. So until unless you discuss about it, there is nothing wrong about it. It's a physiological phenomenon. You get pregnant, you give birth to child, you have periods every month, and there is it is like a daily, what you do, urination and motion, defecation. This is also physiological phenomenon. So what is wrong with the periods when you have it monthly? This is just a part of the reproductive process, that's it. Now many companies have allowed period leave, and internationally there are few companies which have come up with this, and that's a very good idea. In India, as you said, yes, they don't want their colleagues to know that they are going through periods, or they have a problem during periods. They don't want to let their colleagues know, so they are not availing those leaves. Until unless we openly talk about it, it's very difficult to overcome those hurdles and overcome those myths. So talking about it openly and talking it in a better way, and not creating it only a women's problem, will help us overcome this. So men have to get involved in this discussion, the family members have to get involved, so that it is not a taboo topic anymore, and we can...
School children or in the school, because most of the awareness will happen at home, at school. So what is your guidance for this? And also the other thing is because most of the girls or the families, they can't afford napkins. So is there any simple and economical way to be very hygiene and take care of this?
So it is very important that once a girl is growing up in the family, so parents talk to her, they tell her what are the biological changes she can expect to go through in her body. This is very important because they feel a sudden change in their physique, their appearance, they start growing hairs, they have breast enlargement, and all those things, it bothers them a lot, and they start thinking why it is happening to them, and they don't want to discuss until unless their parents are open to it. So parents should tell them, in case they find it difficult to talk to them, they can bring the child to the gynecologist, and the gynecologist can explain it to them nicely. Second is schools. I think most of the schools now are regularly doing some kind of awareness programs for class 5 students and class 6 students and above on puberty and the developmental changes. So these are the things which can help them understand the physiology and what are the changes they go through this time. Now, as you said, the economical thing. So nowadays we have these menstrual cups. So these menstrual cups are made up of silicone, and they can be used for lifetime even. So they can be washed, they can be reused, very economical, and also it helps you protect your environment also, because sanitary napkins disposal is a problem. It's a huge issue actually. It's a lot of tissue which has to be disposed of, and sometimes they are non-biodegradable as well. So using silicone cups is a very good idea, and it's a very good product, very easy to use also. In case you find it difficult for the first time, your doctor can help you with that. So silicone cups come in different sizes, small, medium and large size. So for young girls, a smaller size fits very well, and definitely they'll find it difficult to insert it for the first time, but reach out to your doctor, they will definitely help you. It is the cheapest solution, and in case they cannot afford, we can donate to few families. So these things can be done. Now, when only sanitary napkins were there, it was difficult to buy it every month, and disposal was a problem. But with these cups, many of the organizations are also distributing it in the rural areas. So this cup awareness also needs to come out, and society should know about it.
Okay. Our last question. Now we have made this foundation. So, is there any? Are you creating any awareness or run in the coming months or years on this?
So our main aim of our foundation is to create awareness along with the teaching. So not only the patients, teaching for the doctors is equally important, because endometriosis is one disease which is treated by all the gynecologists, but still patients land up with multiple failed surgeries because of the lack of expertise. So we are aiming to educate doctors, train them properly in these surgeries, and for that in March we are doing a conference as well for doctors, and probably we might come up with a awareness run where you all can join us and create more awareness and a buzz about painful periods and endometriosis.
All the guidance, and I'm sure a lot of people will participate in the run which your foundation is planning for the next year. Thank you.
Thank you so much. Thank you for doing this.